Did you know that the United States has some of the most surprising health statistics in the world? We often think of ourselves as a healthy nation, but the reality is a bit more complicated. From obesity rates to healthcare spending, there are some eye-opening facts about health in America that you might not be aware of. In this video, we're going to dive deep into these surprising statistics and what they mean for us. We'll explore the factors contributing to these trends and discuss potential solutions. Knowledge is power, and by understanding these issues, we can start making healthier choices for ourselves and advocate for better health policies in our communities. So, if you're ready to learn some shocking truths about health in the United States, buckle up. Stick around to find out more, and don't forget to subscribe for more eye-opening facts. Let's talk about the elephant in the room, or should I say the elephant on the scale. The United States is facing an obesity epidemic. Over 42% of adults in the US are considered obese, and that number has been steadily rising for decades. This isn't just about fitting into your favorite pair of jeans. Obesity is a serious health concern linked to heart disease, stroke, type 2 diabetes, and even some types of cancer. Now you might be thinking, what's causing this epidemic? Well, it's a complex issue with no easy answers. Factors like sedentary lifestyles, easy access to highly processed foods, and aggressive marketing of unhealthy products all play a role. It's not about pointing fingers, though. It's about understanding the problem so we can start working towards solutions. We need to promote healthier lifestyles, make nutritious food more accessible, and encourage regular physical activity. It's not just about individual choices, it's about creating an environment that supports healthy habits. Remember, we're all in this together, and by working together, we can combat this epidemic and improve the health of our nation. You'd think that in a developed country like the United States, we'd be living longer than ever. But here's a shocker. The average life expectancy in the US is actually lower than in many other developed nations. Countries like Japan, Canada, and the UK are all outliving us, and the gap is widening. So, what's causing this discrepancy? Well, several factors are at play. High rates of chronic diseases like heart disease, cancer, and diabetes definitely contribute to the problem. Additionally, issues like opioid addiction and suicide rates also play a role in lowering the average life expectancy. It's a complex issue with no easy solutions, but we need to address it head-on. We need to focus on preventative care, improve access to quality healthcare, and address the social determinants of health that contribute to these disparities. It's time to start prioritizing our health and well-being if we want to live longer, healthier lives. Chapter 3. The Burden of Chronic Diseases. Here's another startling statistic. A whopping 6 in 10 adults in the United States have at least one chronic illness. These conditions like heart disease, cancer, diabetes, and arthritis are the leading causes of death and disability in the country. They also place a tremendous burden on our healthcare system. But what's driving this high prevalence of chronic diseases? Well, many factors contribute, including poor diet, lack of physical activity, smoking, and excessive alcohol consumption. These lifestyle factors, combined with genetic predispositions and environmental factors, create a perfect storm for chronic illness. The good news is that many chronic diseases are preventable. By adopting healthier lifestyles, managing stress effectively, and getting regular checkups, we can significantly reduce our risk of developing these conditions. Remember, prevention is key. Chapter 4. The Mental Health Crisis. We often focus on physical health, but mental health is just as important. Unfortunately, the United States is facing a mental health crisis. Millions of Americans suffer from mental health conditions like anxiety, depression, and PTSD, and the numbers are rising, especially among young people. The stigma surrounding mental health often prevents people from seeking the help they need. We need to break down these barriers and create an environment where people feel comfortable discussing their mental health and seeking treatment. Remember, it's okay not to be okay, and seeking help is a sign of strength, not weakness. If you or someone you know is struggling with a mental health condition, please reach out to a healthcare professional or a mental health organization. There is help available, and you don't have to go through this alone. Chapter 5. The Price of Health. Let's talk about money. The United States spends more on healthcare per capita than any other country in the world. Yet, despite this massive spending, we don't see better health outcomes compared to other developed nations. So, where's all the money going? Well, the US healthcare system is incredibly complex and fragmented. Administrative costs are high, drug prices are exorbitant, and there's a lack of emphasis on preventative care. We need to find ways to make healthcare more affordable and accessible while also improving the quality of care. This is a complex issue with no easy solutions, but it's a conversation we need to have. We need to explore ways to control costs, improve transparency, and prioritize preventative care to create a more sustainable and equitable healthcare system. Thanks for watching. If you found these facts surprising, give this video a thumbs up and share it with your friends. We've covered some tough truths about health in the United States, but awareness is the first step towards change. Remember, our health is our most valuable asset. By making healthier choices, advocating for better policies, and supporting each other, we can create a healthier future for ourselves and generations to come. See you next time.